What if your exhaustion isn't laziness, but low iron? 8 hours and coffee, still wiped? Your cells may be oxygen-starved. Stay with me. 8 science-backed signs in minutes. You wake up, you drink your coffee, you sit down and your brain sends an RSVP. Not today. That persistent tiredness, even after decent sleep, is the exact symptom we're starting with. Relatable, annoying, often a clue. Today I'll walk you through 8 science-backed signs that low iron could be the sneaky reason you're dragging. Low iron means less hemoglobin, which reduces oxygen delivery to your body, causing persistent tiredness. If fatigue limits your daily life, ask your clinician for a complete blood count and ferritin test. Number 2. Pale skin. Lower hemoglobin can reduce the natural redness in your skin. For a quick check, gently pull down your lower eyelid. If the inside looks paler than usual for you, it could be a sign. And number 3. Brittle hair and nails. Iron is essential for strong hair and nails, so deficiency can cause splitting or weakness. Number 6. Pale skin. Lower hemoglobin can reduce redness in your skin. For a quick check, gently pull down your lower eyelid. If the inside looks pale instead of rosy, it's a classic clinical sign. Number 7. Shortness of breath. Your heart and respiratory rates rise to compensate for low oxygen. This can make mild exertion, like climbing stairs, feel much harder than usual. The severity can range from mild awareness to fatigue to breathlessness that limits daily tasks. If you're noticing breathlessness or palpitations with light activity, bring this up with your clinician promptly, especially if symptoms are worsening or limit normal function. Providers will evaluate heart function, evaluate lung function, check hemoglobin, check ferritin. Don't ignore exertional symptoms. They're signals your body needs help. Other conditions can cause similar symptoms, heart and lung issues among them, so testing helps pinpoint iron deficiency or rule it out. If iron deficiency is confirmed, treating it often improves exercise tolerance and breathlessness over weeks to months. When brain tissue gets less oxygen, reduced oxygen carrying capacity, you can feel dizzy or lightheaded standing up quickly. Cerebral hypoxia can be brief but frequent or more persistent depending on hemoglobin. It's disorienting and understandably scary. Iron-related dizziness often comes with other signs. Fatigue, paler skin, palpitations, but it can appear on its own early. Pay attention to when dizziness happens. Upon standing during exertion while sitting quietly. That pattern helps your clinician. Keep a log of dizzy spells. Activities around the episode, how long it lasted, any other symptoms. Frequency and triggers matter clinically, helps prioritize tests like CBC, ferritin, orthostatic blood pressure checks. If dizziness is severe, prolonged, or accompanied by fainting, seek immediate care. Correcting iron often reduces dizziness as oxygen delivery improves. Dizziness has many causes. Testing ensures the right diagnosis and the safest, most effective treatment plan. When oxygen delivery is reduced, your body prioritizes core organs and can restrict blood flow to the skin and extremities, which can make your hands and feet feel cold. Vasoconstriction plus lower oxygen availability can produce a persistent chill in the extremities that doesn't match the room temperature. It's common and often overlooked. People may, chalk cold hands and feet up to circulation quirks, poor circulation, or just a preference for being chilly. But when it's persistent and present with other symptoms, it's worth investigating. Fatigue, paleness. Think of it as another small piece in the broader puzzle of iron status. Because cold extremities are non-specific, clinicians will consider other causes, thyroid issues, Raynaud's phenomenon, and more, while also checking iron markers if the clinical picture fits. If low iron is found, treating it can improve how warm your hands and feet feel over time as circulation and oxygen delivery normalize. If you notice this symptom alongside others we've discussed, mention it during your visit. Ask whether iron testing makes sense for you. Document how long it's been present, seasonal constant to help narrow causes. Iron is a building block for many cellular processes, including the rapid growth of hair and nails. When iron is insufficient, those tissues can suffer. Nails may become brittle. Nails may become thin. Nails may develop spoon-shaped depressions, called koilonychia. Hair may shed more than usual. These outward changes can be both cosmetic and functionally meaningful. Hair shedding might feel subtle at first. More in the shower drain, more on your brush over time. It can thin your part or decrease overall volume. Nail changes. Splitting, ridging, spooning. Classic signs clinicians look for. These signs aren't exclusive to iron deficiency, but are a recognizable pattern when paired with fatigue or paleness. If you're experiencing hair loss or nail brittleness, clinicians will ask about diet, hormones, medication, stress, and often order ferritin and CBC. Restless leg syndrome, an uncomfortable urge to move your legs, especially at night, is strongly associated with low iron in many people. The biology is complex. Low brain iron seems to affect dopamine pathways linked to movement. If you're suddenly unable to sleep because of leg discomfort, check iron. Pica is craving and chewing non-food items, ice, pagophagia, dirt, clay. This is another red flag tied to iron deficiency. Cravings for ice are common and often resolve once iron stores are replenished. These behaviors can feel embarrassing to report, but they're important diagnostic clues. Don't dismiss these symptoms. Tell your clinician if you have restless legs, unusual cravings, nighttime leg discomfort that disrupts sleep. Tests like ferritin CBC, treating iron deficiency, can produce substantial relief. If you or someone close to you has these signs, consider tracking when they occur and how they affect sleep and daily life. That context helps your healthcare provider decide which tests to run and whether iron therapy may help. Clinicians use symptoms and lab values, like ferritin and hemoglobin, to see if iron deficiency is the cause. If tests show low levels, your clinician will discuss dietary changes, supplements, or other treatments. If you noticed one or more of these signs, a simple blood test can confirm if iron is the missing piece. But don't self-diagnose or start supplements without guidance. Contact your healthcare provider for testing and personalized advice. Which of these signs surprised you most? Comment below and subscribe for more evidence-based health videos.